This webinar is presented by the Boxwood Alliance, which is a nonprofit organization. We are all volunteers, all of us that work on this Boxwood, and our goal is to provide services and information to seniors and their caregivers in the lower Hudson Valley area. And we provide monthly webinars the last Thursday of every month on various topics that are important to the aging population. And now we have this week's program. If anybody is interested in joining our board and helping us out with all this stuff, we'd be happy to have more volunteers. And if anybody's looking to support us by advertising means becoming a sponsor, or even donating to our cause, it is all supported by anything we earn on our website, as far as people sponsoring us and donations, and our time that we give as volunteers. So that's our spiel, and I'm going to go ahead and start with Ellen's program. So Ellen, take it away.
Okay, I welcome everyone. Thank you for joining. So I've been actually doing the PACE, working in the PACE model for just almost 20 years. So I've seen it evolve, and I think it's really a wonderful program, and I'm glad you're all listening to hear of new options that are of options that have always been there but are kind of more recognized now. So we can go to the first slide. So the PACE program stands for All-Inclusive Care for the Elderly, and the services that we provide are really comprehensive, coordinated, both medical and social services to frail and elderly people in the community. And once you're on a PACE program, it continues as long as the individual person, we actually call them participants because they participate in their care. So once the participant meets, as long as they meet the qualification and they choose to remain on the program, we have people that stay on for many, many years. What is unique, and I'll explain more as the slides go on. This is kind of just an overview. What's different about a PACE model is that we are both the insurer and provider of care. So if we feel somebody needs a service, since we are the insurer, and it may or may not have been normally been something that you may get covered, you could get it covered through the PACE program, because we are the people that kind of work with you to see what you need, and then we're the people that pay for it. So I'll talk more about that. We cover all Medicare and Medicaid covered services, and as well as any of the services that your healthcare team feels that is necessary to really improve your life and maintain your life and your health. PACE used to always be a not-for-profit program, and there was a trial a couple of years ago. There were 6 for-profit programs that were tried in Pennsylvania. They turned out to be successful. So there are now, as the PACE model grows, and it really is, there are some for-profit companies that are looking to open PACE models because they realize it's really the elite of home care. So you have some even equity firms and so forth looking into just financing for-profit. So Archcare is a not-for-profit, which is where I work now. Archcare is a not-for-profit PACE program, but it is but across the United States it will be evolving. Once you're on the program, there is no monthly premium. If you do have a spend down to your Medicaid, you still have to pay your monthly spend down as you would in any program, but there are no co-pays for any of the services that you receive. Okay, we can go on to the next page. Thanks. So in order to qualify, you have to be 55 years of age or older. You either have to have Medicare and Medicaid. You could be Medicaid only. You could have Medicare and private pay, the Medicaid piece. So that's the insurance piece of it. You would need to require to to be eligible for long-term care needs. And every state is different. So of course, here it's based on New York State guidelines. And that you are able to live safely in the community with some assistance from our program. So that is some of the general qualifications to be on the program. We can go to the next one, please. Yeah. So I know there's a lot on here, so I'll read them. The PACE benefit includes a wellness center, which is, you might think of it as a social day. We call it a wellness center because we provide so much more. It is a place where it's a benefit that you can have all 5 days of the week or choose to come 1 or 2 days. But the wellness center is a place where you come, you could have breakfast, lunch, a snack if you choose to stay later in the day. And there's a recreation coordinator that will provide a variety of different activities during the day. And usually there's more than one activity because not everybody likes to do the same things. There are also aides available. So if there's any assistance with toileting needed or feeding, they're right on site here, and they have the ability to help. Any appointments, if you need a dental appointment, that's covered. Any emergency services, if you needed to go to the ER and you get called an ambulance. Home care services, I'm going to come back to that after. If you're admitted to the hospital, covers your hospital care. Any inpatient or outpatient laboratory services, x-rays. What's nice about a PACE program is that we can do lab work here, and we can do x-rays here on site. Meals are provided at the wellness center, and depending if you meet, there are certain qualifications to get Meals on Wheels, and if you meet those qualifications, that is something that can be provided. Medical specialty services, so we help coordinate all your appointments to your any specialty doctor, cardiologist, neurologist, any doctor that you have. The provider does have to be part of the Archcare plan, so they have to be in our network. I will say we have a very extensive network, and right now, most of the times we do find that people's doctors are in our network, but they do have to be, and we can always check before you join just to see. So we have a very large network of that. And we give them an authorization for your visit, and that gets covered, and you wouldn't have a copay. We have medications. We deliver medications. So really, all PACE programs really work the same. Your medications are delivered monthly to your home. And then if there's something that is needed in between, like an antibiotic, then that would be dispensed as needed. But you would get your medications delivered monthly for your routine medications. Our goal is always to keep people out of the nursing home. That's the primary focus of PACE is to keep people home so that they do not have to be placed in a nursing home. There are times that people might have to go there for some subacute rehab because they require maybe more services at the very beginning, and then we continue at home. So if you needed subacute rehab, then that would be covered under PACE. The same as doctors, you would need to go into a nursing home that we are affiliated with, so that we have a contract with. If someone has to go long-term, and that's really, like I said, that's something a PACE program really tries to avoid, but there are times where that is really something that at the point in time of that person's life is a decision the family makes. That is also covered long-term care at home. So I'd like to point this out though, if someone is a Medicare, Medicaid, Medicare private pay person, because this comes up a lot. If you have Medicare and you do not have Medicaid, but you've chosen to pay per month to be on the Medicaid piece, to be on the plan, you can do that. At that point, though, if you did want to go long-term into a nursing home, you still would need to be eligible for Medicaid because long-term care in a nursing home is always covered by the Medicaid piece. And I know that that gets tricky sometimes for people. So to keep in mind that if you are Medicare and private pay, you would have to, we'd still have to figure out if you can get Medicaid before you went long-term into a nursing home. What PACE also covers is 14 days of respite care, and this would be for anyone, even if you were private paying the Medicaid piece. So you have 14 days a year that you can use in the nursing home, and that would be for everybody. And it doesn't have to be 4 consecutive days. So if you need 4 days now and 5 days later, that's fine. Some families choose to do that when they're on vacation. They feel better because they're not there to check on their loved ones. So that is a respite benefit. I didn't list it here, but that is as well. We have a nutritionist, occupational therapy, physical therapy. All your prescription drugs are covered, as I mentioned. You do not need a Part D. We also are your Part D. We're the entire Medicare piece. Your primary care doctor, recreation, social worker, and we provide transportation to and from all medical appointments. So that is another PACE benefit. Even if your medical appointment is in the city, that is covered. It just has to be within New York. So I like to mention that because we do border Connecticut. We wouldn't transport to Connecticut, but we can transport to other parts of New York. So certainly, if you have a doctor in the city, transportation could be provided for that as well. The home care piece, what I wanted to say is PACE is, we have the home care piece. So we have an office. For us, our office is in Westchester and Dobbs Ferry, but PACE always has to have an office where they are. And there's the wellness center there. There's the primary care doctor office there. And you can get your care here and you can get your rehab here, PT, OT, speech. But we also do primary care. So in the primary care, home care. So with home care, you would have a visiting nurse visit you, a minimum of once a month. Nurses go in more frequently when needed for wound care or if there's a not feeling well. PT and OT can be done at home, or we do it here in our center. So again, PACE always has a rehab in their location, and it's part of home care. Home health aides are covered, so there would be a home health aide if you needed one and you had wanted one. You would have a home health aide. All your DME would be covered. So if someone required a wheelchair, hospital bed, commode, that also is covered, as well as incontinence supplies. So all of those things are all covered under the PACE benefit. Really, PACE is just complete coordination of care. So all your needs, we try and really meet all your needs, both physically and socially. So if you are someone that chooses not to come to our wellness center and you would like some recreation support at home, the recreation therapist could go to the home, bring you some things that you like, and that kind of helps a little bit as well. We could, I guess, the other thing is the only thing that PACE, I would say, is you wouldn't be able to go on to hospice. So PACE does offer end-of-life care in the form of palliative care. If you wanted to be on an actual hospice program, that would be a disenrollment from the PACE program. That's the one thing that's kind of a carve out that you would not have under PACE. I will tell you that our palliative care is very extensive. You have increased nursing visits. You can have your doctor visit at home. You can have, you would receive what is called, when someone has end-of-life care, kind of a med pack, nausea medicine, morphine, those kind of medications that you would have end of life. It's a similar pack as hospice does, just we give it out. and your home health aide. And certainly at end of life, sometimes people require more home health aide hours. So your services are similar, if not more, than you would receive during hospice. For those that may be wondering, then what's the difference? Because the palliative care that PACE program offers is more services than a hospice program would. What hospice does is hospice does offer counseling continuous. I believe it might be a year for the families afterwards. That is not covered under the palliative care, but at end of life care, there are a lot of services that are offered and provided to the family. So we really stay on top of people to provide comfort at that time. You can go to the next page. Okay. So yeah. So everyone, when you join a PACE program, you're assigned an interdisciplinary team. We call it an IDT team, and that consists of professionals and paraprofessional staff that all do an evaluation, develop a care plan in conjunction with you or your loved one. Everyone's involved in the plan of care and the delivery of the services. The professional services are your nurse, your doctor, your OT, your PT, your licensed healthcare professionals. The paraprofessional staff is there is a coordinator that is assigned to help schedule your transportation, and there is a coordinator that will help schedule your home health aide, and they are part of your interdisciplinary team. So they're part of your care plan meeting, so we can hear any concerns you have about the aides, how transportation is going. So that's what the paraprofessional staff do. We coordinate and manage all of your services and care needs, and it's all done through this team. We meet every 6 months, initially when someone comes on, the month they come on, we meet every 6 months after that, and always can do a special meeting at any time the family requests it, or we feel there's a change in someone's status and your interdisciplinary team thinks, we need to bring this to the attention and see what we can offer as someone's aging in place. So that's really your whole interdisciplinary team. We can go to the next one. I think I really spoke about this, that the services will be provided. Those are all the services that I had just mentioned before. They will be all part of your interdisciplinary team. What I would really like to just kind of mention a couple of, I would call them real success stories. I received a call from someone from a nursing home, his care manager. And this was a gentleman who was really giving them a hard time in the nursing home, wanted to go home, really had a lot of needs, and he was kind of labeled difficult. And I'm sure that he wanted to go home, and they really didn't know what to do with him. And some programs actually turned him down. They called me, we evaluated him, and we did bring him onto our program. And he had quite a bit of behavioral needs, quite a bit of not so nice language to everybody, and really we just kind of had to get him on board. So our team all met with him, everyone spoke with him, we started to provide care, and we made him comfortable in his home with a wheelchair, the right bed, the right mattress. We have a variety of different mattresses we use when someone has a hospital bed. And he came to the wellness center, not willingly, actually. And by the end of, I would say it took him maybe about a month, a lot of work. He loved it. He asked to come every day. His language improved to where we like to see it. He was nice to the other participants here. And we got a beautiful letter, a call from his family member, thanking us for taking the time and the patience to provide all the services that he needed. And after months and months and months in a nursing home and they not knowing what to do, they were so happy that we were able to take him on and provide him all the care. He was able to walk, and he was really a very big success story. We had another woman who the son called, his mother wouldn't get out of bed. They had staff come and they were there for short periods of time, and they really couldn't, he didn't know what to do with her. She wasn't getting out of bed. So we went to the home, and I have to tell you, from someone who wouldn't get out of bed and came in here with a wheelchair, she, by the time she was done, she was walking from a wheelchair, not getting out of there. She was walking with a cane. So we really have very, very strong PT, OT, nursing, and really it's a team approach. And what I like to say is, because we are the insurer and provider of care, we don't have to cap something. So if someone is showing improvement, we will continue, our therapy department will continue to provide therapy. So we have people that require a lot of assistance from a social work, maybe need some counseling, so they may need more social work services. There may be people with weight loss or weight gain and just need to, either obviously put weight on or lose weight, and our nutritionist will come up with a diet plan for them. So I'd like to say that in the PACE model, because it's very coordinated, it's very comprehensive, we take a look at what each individual person needs and just cater the care plan to what they need. And we recognize that everybody's needs are very, very different. But when I say we're located in Dobbs Ferry, but Archcare covers all PACE programs will have a location. So some people prefer to get their care in the office, and some people prefer to get their care at home, and we will adjust that to what they need. I could probably think of a lot of success stories, but it's what makes PACE, why I've stayed with PACE for 20 years is just the fact that I think it is so comprehensive, and people really can get all the services that they need with as much of it as they need, and we don't have an end date. So there are people that stay on our program for years. We also have people that have been kind of discharged from therapy, and 6 months down the line, they find that they're getting weaker. We evaluate them and we can bring them back on therapy. And everyone gets to know everyone. So we know everyone's strengths and weaknesses and what they need. And it really becomes a very nice arrangement and setup. So the last slide is really just my phone number if anyone has any additional questions, but I think you said there's a chat. If there's any Q&As, I'm happy to.
Yep, I'm gonna get you right to that right now. That was excellent. Thank you so much. So far we have 2 questions.
Okay.
And I also have something that I want, and maybe I didn't hear it, but how are you funded? Are you mostly funded through Medicaid? Do people private pay?
Yeah. So that was so it's Medicare and Medicaid, or Medicaid only, or if you only have Medicare, you could private pay the Medicaid piece. Okay. And for some people, it's helpful because if they want to spend down there, that's a way some people do that.
Okay, so in answer to that, somebody asked, how much is private pay if you have the Medicare and a private pay combination?
Okay, so our private pay is $6,900 per month. And where I know that sounds like a lot, it certainly is a lot. There are some people at home that actually pay $15,000, $20,000 a month for a lot of aid service that they need, and for transportation service. So it really is something that depends on what your needs are, if you feel that is worth it for you. But it does cover all of your services.
So if somebody had, let's just say, and you approved 12 hours a day of care, 7 days a week, would it still be $6,900?
So the $6,900 is for everyone, regardless of what they're receiving. So
Okay.
once you're on the program, everyone's looked at the same. As a matter of fact, my staff, the staff don't even know who's private pay or not. Everyone is treated exactly the same. So if you have 2 hours or 12 hours, you pay the same thing.
Okay, good. That
Yeah.
was the answer I was looking. Does the visiting nurse set up medications during home visits?
So so the answer is yes. So what we can do is we send it in prepackaged AM, PM, and the date on it so that it's easy to use. For those people that prefer a pill bottle into a pre-pour box, the answer is yes. The nurse will go and fill a pre-pour box up. So if someone still wants to do it that way, it's not a problem. And if someone is on the prepackaged medications, sometimes during the month, the medication changes, the nurse will go out and remove it from the pre-filled packages.
Just as a comment, that's a very big difference from the other Medicaid home care services because they don't get any nursing visits. Nobody comes to the house ever for medications or otherwise. So that's a pretty significant difference for somebody who is looking for a program where that is really something you need to do.
Right. And if someone's not feeling well, you don't have to always run to the doctor. A nurse can come and visit and collaborate with our physicians who right here in our, with us. And certainly if there is a need, then we would say, oh, you know what, you do need to see the doctor. But a lot of stuff, we also have 24-hour on call, which I didn't mention, all PACE programs do. So there is always a registered nurse and a primary care provider, which would either be an MD or MD or nurse practitioner, 24 hours a day to answer any questions. So that's after hours and weekends and holidays.
Okay, great.
And we do, if someone is, let's say, on a daily wound care and they have to be seen on a Saturday or Sunday, we have a nurse that we would send a nurse to you Saturday and Sunday for the wound care. One last piece that that I can speak for Archcare. Every PACE program, and this might be different, but for us, we work with a wound care company. So we have a wound care doctor that will go to the home and really evaluate or debride a wound in the home. And then the home care nurses will carry out the treatment plan until the next visit. And that's a really big service. So you don't have to run over to a wound care clinic. This way, the wound care company physician goes right out to your house.
Excellent. So the next question is, do you cover the 5 boroughs of New York City? And I would expand on that and say, what do you cover? I mean, where
So Archcare covers Westchester. The PACE program covers the Bronx, Manhattan, Staten Island, and Westchester. We do not cover Queens right now.
That's weird.
Queens and Brooklyn, yeah, because it's part of the Archdiocese. So those are the ones that we were allowed to cover.
Okay, and I just would want to add, although we love Archcare and they're wonderful, there are other PACE programs out there that could cover other areas that
Yes.
are not included in Archcare's network. So
yes,
in upstate and other places, there are many different, not many, but there are other PACE programs that provide maybe not the same quality, but certainly the same services. So
Yes.
that if you're not in their area, that doesn't mean you can't use a PACE program.
Right. There's PACE programs all the way up to Buffalo. There's quite a few in Florida and New Jersey. And there's PACE programs in all the boroughs. Archcare just covers those. But there's two PACE programs in this area. It's Archcare and Center Light. Those are the 2 PACE programs if you're looking in this area, so that they do cover Queens and Brooklyn if you know someone there.
Okay, and how would one apply for the program?
So I could put up the last slide. My email is Gloskin, Gloskin @archcare.org. But my phone number, which is probably the easiest, is 914-326-3111. And I'm always happy to give people a tour of the wellness center. People like to see it, or the rehab room. If people want to meet the staff, sometimes people want to meet the doctors or the rehab staff. Everyone is welcome to. You can set that up with me. come in, meet them, just to make sure that this is what you like. We always hope people join and stay on the program, but it is a program that you can disenroll from. It's not a once a year thing like some insurances are. So we like to hope that you'd be satisfied, but certainly if you weren't, you disenroll the following month. So it's not a year thing. Right now, I know they're talking about that in the government, but really right now it's a monthly thing. So, that's just an option that you have as well.
Great. I did type in Ellen's name, phone number, and email address in the chat, just to make it easier than trying to pop up that thing again.
Okay.
Okay, I still have more questions for you.
Good.
Are dental vision services covered?
Okay, so yes, dental is covered. We use HealthPlex, so the doctor would have to be in HealthPlex. And yes, that dental, dentures, all of that is covered, and audiology is covered, and what was the vision? Yes, vision is covered as well.
And somebody asked about transportation as well.
Yeah, so we transport to all medical facilities.
Right.
Any medical appointments are covered, as long as it's in New York. So if you had an appointment in the Bronx or in Manhattan, that's fine, but we don't transport to Connecticut. And I always like to say that because we border Connecticut.
Yeah, it's definitely a problem for people who live in Rye and Portchester, almost like
Yes.
Connecticut. I had another question for you,
Yes.
which I just lost my thought. All right, I'm gonna see if anybody else has any other questions while I try to regroup on mine, because it was something that I thought, oh, I know what it was. So I know that your primary physician has to be affiliated with the program. Did I miss you talking about that piece?
Okay, so I'm glad you brought that up. So the primary care doctors, so like I said, I've been with PACE for so long, used to always have to be a PACE affiliated doctor. So they had to be employed by, and I'm sorry if I look like I'm not looking at the screen, it's the angle of this computer. So it used to be that they had to be employed by the PACE program. And then it evolved into a community-based program where some doctors in the community you can keep, and we work closely with them. So it's evolved even more. So there are some doctors in the community that are willing to keep you as their patient, and we provide all the care for them. And it's working out really nicely, actually, because they like the fact that if a patient calls not feeling well, they can ask us to send a nurse out. Maybe you don't have to, especially in the snowstorm or bad weather, go there. So you can use community doctors. So if you're interested, I would say you can always ask. We'd have to look it up, but the answer is no, they're not. They no longer have to be an Archcare employed primary care doctor. It could be the community, as long as it's a doctor that we have an agreement with.
You just have to have an agreement signed between
Right.
the doctor and you. And specialists still continue to be outside the program, right?
The specialists are outside of the program. What we do offer, they have to be part of the network, but we really, over the past, I would say 6 months, have added a slew of providers in Westchester. So we really have a lot of providers. People can always ask me ahead of time, and I can just make sure that their doctor is. But what we do offer people for eye care is you can go to a provider in the community that we have contract with, or we bring eye care here to our location. So for people that would prefer to maybe be in the wellness center for the day and then just come and see the eye doctor, we have them come here a few times a year, and we can definitely set that up. We do podiatry. You can do that at a doctor's office, and we have the podiatrist come here as well to our clinic and work here. So you have an option of what you prefer.
Okay, great. Somebody said specifically, can the community MD be with New York Presbyterian? But that kind of leads me to a question, which is these big conglomerates of doctors, Caremount, New York Presbyterian, Westmed, do you find that is difficult to get those doctors to onboard?
Those big groups, yes.
Yeah, I thought
Montefiore, no.
Yeah, Montefiore, you have a good relationship with.
Well, Montefiore doctors seem to be a little more, yeah. Westmed, really, I can honestly say, no, no. Claremont, New York Presbyterian, we kind of have to try as we go. It is a little harder. The smaller practices, I know there's not as many, but the smaller practices or a lot of some doctors in White Plains Hospital, I just bring that up because kind of in the middle, everyone seems to go. That usually seems to be easier, and Montefiore definitely seems to be the easiest.
Do you guys have a list somewhere of participating doctors?
There was a list on our website, but I think we've added so many that to be honest, I don't know if you can look on the website, but there's probably a lot more. So if you look onto Archcare PACE and you don't see it, I would always say the best thing is to call me. I always tell people, call me, give me the name. I can have our coordinator check in 5 minutes. It's so much easier. So I don't mind that, to do that.
Great. Well, this has been super informative and really helpful, I hope for everybody who's attending. I am going to just give everybody another moment. If there's any last minute questions before we close out the webinar, I want to make sure people who are interested get their questions answered, but we did have a lot of good questions today. So I think that's great.
Yeah, and we have patients, participants that are on dialysis. So dialysis is not a deterrent. We do transportation on the weekends too. So excuse me, you have a weekend dialysis, it's fine. We do the dialysis. It really is a nice program. I will say, if you do look it up under Archcare PACE, it's also called Archcare Senior Life. So if you see Archcare PACE or Archcare Senior Life, they're interchangeable. So it's exactly the same program. So don't get confused. Community Life is another program, that's our MLTC, but Senior Life is ours. And I always, I always welcome any questions or calls, or just look up a doctor for you. That's not a problem at all.
Okay, I'm going to have one last question because nobody else seems to have any, so I'll ask it while we're giving them another minute.
Sure.
If somebody has to be placed in a nursing home, that's just where they're at this point, and they don't want to go to one of your affiliated facilities, and they disenroll from you and go where they want?
Yes, they can. We have had that happen, and what we do is we have to coordinate the discharge kind of at the end of the month. So there is coordination with the facility to do that, but the answer is yes.
Okay, we did get one more question, which I know I can answer, but it says, so is PACE considered an MLTC? It's within the family of Medicaid home care services.
Yeah,
but it is a separate program, and they function differently.
Right, you answered that very well.
They do overlap with a lot of the things that people are looking for, but you're much more comprehensive in what you can offer.
Yeah. We're comprehensive and we're very hands-on. So you'll have a phone number to reach your PT, your OT, your nurse, and you'll get a call back right away. Our number doesn't go into an answer, kind of an answering service. Unless it's after hours, you'll get the receptionist who will transfer the call or will give the message for someone to call back.
Yeah, and I think if you are not desperately tied to your primary doctor, it's a really great option. The primary doctor won't join. So as long as you can get past that barrier, if it in fact is a barrier, I think they're really a great program. Oh, we got another question.
Okay.
Do you offer speech therapy?
Yes.
That's what
yes. And I will say another thing we're doing. We have a program now. A lot of this came out of the pandemic, of course, where we can, because there's still some people a little hesitant of people coming into their home, but it's open to everyone, where we could hook up onto your computer, kind of like a telehealth. And you can schedule, let's say you do need speech or you want your social worker, but you don't really want them in your house right now. You could schedule a time with them and do it just like we're doing this through telehealth.
That's great.
So we have that option as well. So if that's something you want, we set you up with it right away.
Excellent. Well, I can't thank you enough for joining us today, and I hope everybody found this to be interesting and helpful. And if anybody's interested in the program, I suggest that you give Ellen a call, and she can help you along with the process. And thank you.
Thank you for having me. Thank you for inviting me.
Everybody should know that we will be, it usually takes a week or two, posting this webinar on the boxwood.org website. So, and it will be there somewhat permanently, so anybody can review and learn more about this program and understand what it offers. So thank
Okay,
you again,
thank you.
everybody. And have,
I think something popped up, one new message.
this has been fabulous. Thank you so much. Great information. A lot of kudos is what you're getting.
Oh, thank you. I'm glad you enjoyed it. I just see the red thing pop up. So thank you. Thank you.
Absolutely. Thank you so
Okay.
much. And everybody,
care.
have a great evening. Thank you for coming. We have the next one, which is April 29th. I don't have it in front of me, what we're presenting, and I apologize for that. But go check out the boxwood.org. On the lower right-hand corner of our homepage is always the posting for our next webinar. It usually takes us about a little bit of time after today's webinar to get the new one posted, but please keep checking back to see the information. And thanks.
Thank you.
Okay.
Bye-bye.
Bye.